There you have it.
I'm going to call Barbara Stewart. Barbara Stewart.
Thank you, Mr Chair. I'm very pleased to take a call in the estimates debate. We continue to be astonished in New Zealand First at the lack of preventative programs that are rolling out across the country. The government doesn't appear to have a plan for serving the needs of the current population, let alone the future generations. And it is a worry because this is an issue that is seriously affecting the health of New Zealanders. Non-communicable diseases are on the increase, and we need that fence at the top of the cliff rather than the ambulance at the bottom, because we know that that ambulance at the bottom is slowly breaking down. We want the government to be forward-looking, and it was quite interesting when we met the Minister to catch up with the lack of programs that had a preventative focus. We know that the need for healthcare is going to increase dramatically over the next few years, so we need that preventative focus, absolutely essential. Our nation's health is at critically poor levels, with ever-increasing numbers of people suffering chronic illnesses and non-communicable diseases, and that is a shame. Cancer. There's an urgent need for more research into cancer prevention and treatment. We're falling drastically behind Australia in our treatment of cancer. For all cancers, New Zealand's survival rate at 5 years after diagnosis is 4% lower than that of Australia. The government states that reducing the burden of cancer is one of its top priority areas, yet this is an area that remains drastically underfunded. We were very pleased to see the Minister say there was going to be a new rollout of a cancer strategy. We would like to see the bowel cancer strategy increasing and the rollout of the screening programs increasing. We can't afford to wait until 2017 when the Waitemata trial finishes until we have another 1,200 Kiwis every year dying from bowel cancer. And of course that has a drastic effect on families and the hospital system. Skin cancer. We have the highest death rate in the world from skin cancer, and this does need to be urgently addressed. Obesity. Our obesity rate is continuing. We now are third in the world, rapidly closing in on Mexico and the USA. We're an outdoor country, really shameful for us to have this type of, this rate of obesity. Critical health services. When we look, the ambulance service needs to be have more funding. We know for a fact that people are complaining about the length of time that they're having to wait for ambulances. The ambulances provide a very critical role, and we need them there when we need them most. We expect them to come, so extra funding actually required in this area. When we look at elective surgery, the need for elective surgery is increasing. We get more and more people coming to our doors saying that they're on the waiting list, and they are waiting and they are waiting, and they don't want to wait any longer, which is a shame. We know that despite the increase of $98 million to the elective surgery, it's not going to cope with even the current needs. There are far too many people that go to the hospital, wait to have an appointment, and then are told to go home. They're even called in for scans, don't get those scans, go home and have to come back the next day or the next week when they can get an appointment. Mr. Speaker, we all know that we've got an ageing population, and of course this is going to mean a really sharp increase in all the diseases associated with ageing. Alzheimer's, osteoporosis, macular degeneration, type 2 diabetes. We know the population is set to double. Why aren't we doing something about the planning and investment in this area to try to meet the needs that we know are actually coming? Skin. Today I had a visitor that is very interested in rural health, and rural health is an area that's been sadly underfunded by the government. The Healthy Bastards group came to see me and they focus on men's health and they cannot even get an appointment with the Minister to discuss the work they're doing.
I call